Well, we'll go ahead and get started. Well, just want to thank everyone for being here today. It's another amazing thing we're doing in Broken Arrow, and the partnership with St. Francis and being able to do PulsePoint is something that's really special, that's going to save a lot of lives, I think, in Broken Arrow. And that's we're so focused on public safety and treating people well and taking care of our citizens, and this is another way that we can do that. So I just wanted to welcome everyone here today and appreciate you being here. And this is, again, another amazing thing that we're rolling out, and I'm really, really happy to be part of it. And I'll turn it over to Chief Jeremy Moore.
Thank you. Thank you, Mayor. We are honored today to announce the launch of PulsePoint. This is a great endeavor, as the Mayor mentioned. I would like to point out a few people who are here today that will be joining us. Obviously, Mayor Thurmond, also our City Manager, Michael Spurgeon, he'll be speaking in a minute, and the Senior Vice President of St. Francis South, David Weil. And we're also joined by a cardiac arrest survivor who will be speaking and telling his story here in Broken Arrow. School teacher Roger Green, he'll be also speaking momentarily. And we're also joined by City Councilor Mike Lester. We are proud to have partnered with St. Francis South on this initiative to bring this innovative technology of PulsePoint to our community. Nearly 1,000 people die across the United States every year from sudden cardiac arrest. The quicker CPR can be initiated, the more likely that patient is to survive that incident. PulsePoint alerts CPR-trained citizens, and those citizens can be off-duty firefighters, off-duty police officers, doctors, nurses. Any citizen trained in CPR can then respond to a person in need of CPR and perform those services. Every minute counts in cardiac arrests, and while our fire department has excellent response times, PulsePoint provides the community nearly an unlimited amount of CPR-trained citizens who can also respond to incidents. We have 7 fire stations strategically located throughout town to provide quick response, but with PulsePoint, it could be the person in the business right next door, it could be someone in the restaurant that you're eating in, it could be a pedestrian walking down the street who is trained in CPR and can immediately provide that assistance even before our arrival. PulsePoint also notifies citizens of the nearest defibrillator. Many studies have shown early CPR and defibrillation dramatically increases your chance of surviving a cardiac arrest incident. Broken Arrow Fire and the City of Broken Arrow is proud to be the first agency in the state of Oklahoma to launch PulsePoint and use PulsePoint for our citizens. However, PulsePoint is used by over 1 million users across the United States. Over 2,000 different agencies in 30 different states use PulsePoint, and since PulsePoint began, over 45,000 citizens have been activated to over 16,000 different cardiac arrest incidents. We absolutely believe PulsePoint will have a dramatic impact on the survivability of citizens in our community, and this would not have been possible without the partnership of St. Francis South. So again, I would like to say thank you to David Weil, the Senior Vice President of St. Francis South, for his willingness to partner with us to make Broken Arrow a safer community. Our council and mayor who continue to support the fire department and all of our endeavors. I'd also like to say thank you to Assistant Chief Mark Stewart, who has spearheaded this project and been able to identify all the locations of the defibrillators throughout town. And lastly, I would like to say a special thank you to our City Manager, Michael Spurgeon, who continues to support the city and continues to make Broken Arrow the safest community and one of the most innovative communities in the United States. So at this time, I would like to turn it over to Michael Spurgeon.
Thanks, Chief. You know, 2 weeks ago, in USA Today newspaper said that Broken Arrow was the 29th best city to live in the country, and one of the main reasons why we got that designation was how great our public safety is. And this is an example of the importance of public safety. And when people think of public safety, they always think in the tradition of the police and fire, but with today's technology, there's opportunities for those that are trained to be able to help those that are in need, which we're going to hear a little bit about. I mean, it's great to be here this morning to talk about this partnership. It's also awesome, and it's a privilege and blessing to be standing in front of these men and those public safety officials in the audience out there, and to have the opportunity to represent them. And so I just wanted to say thank you for all of you being here today, and to thank you for all that you do. I also want to thank Mayor Thurmond and Councilman Lester and the other 3 council members who unfortunately couldn't be here today, to thank them for their leadership. Whenever we come to the council and ask them for support, it's either yes or they try to find a way to get to yes. And that's the type of people that I think is important that's leading the city of Broken Arrow. I just want to mention a couple of things, and then we'll turn it over to David. This is an opportunity to say thank you to Chief Moore and to Chief Stewart for their leadership, and also to the other members of the fire administration. I mean, we have a number of individuals who wear white shirts, and each and every day they're out there either leading the men and women in the Broken Arrow Fire Department, or they're advising the chief on best practices and ways that we can continue to make Broken Arrow's fire department and our public safety as the best that it can be. And that's what's important to me as city manager, is that we have leaders that are always looking forward, that are leaning forward and looking at better ways to serve our citizens. And this partnership that we have with St. Francis is an example of that. As the chief mentioned, Broken Arrow is the first city in Oklahoma to utilize PulsePoint. While there are 2,500 other cities in 36 states, to be able to say that we're bringing this to our citizens is a tremendous opportunity and great accomplishment for the chief and his leadership team. The chief talked about the importance, some of the advantages of PulsePoint. For me, trying to keep things very simple, I think we all know that anytime you have an opportunity to detect a cardiac arrest and to provide CPR or defibrillations very soon, the chance of survivability is much greater. And this is going to give us that opportunity. And also, I think that it's going to help those folks that have this app to be able to help those that are in need. And I think that's something that Broken Arrow has, a giving spirit, and this is another opportunity for us to give back to those that may have a need. So at this time, I just would like to thank David, and I'm going to ask him to come forward and also just once again send out a shout and kudos to the Broken Arrow Fire Department and our police department for all they do for our great city. Thank you.
Wow, what an honor and a privilege to be here. I appreciate that. And thank you to the community leaders of Broken Arrow for allowing and providing the support for this wonderful program with PulsePoint. So, St. Francis honors its long-standing relationship and history with this community of Broken Arrow. As we stand here today, we've probably got more than 1,500 of our own employees who live in Broken Arrow, plus their families. So we've got a lot of people who live here, and so not only do we support your community and honor it, but it's an important part of our everyday life. As a hospital, we see the linkage and the importance to care transitions and population health. And what I mean by that is, what we have are a lot of patients who we move throughout our hospital. And it's important, if they're in the emergency department, how we transition them to the operating room or transition them to the patient floors. But really, a lot of that transition really starts, that care transition starts with the first responders. And so the first responders are the ones who are out in the home, out in the community, bringing those patients to us or another hospital for care. So we see that as really that linkage is how we work together. And so we see it as a seamless in a family unit in that regard. When I think about this great opportunity to extend the reach of the first responders with the integration of PulsePoint, allowing the community to help shave off those valuable minutes. And as you already heard, every minute counts and every minute saves a life. And so we see the same thing, and we know that by engaging the community and shaving off those minutes, we know that the survivability is going to be much greater. So it's from this that I say from the heart that St. Francis has deep admiration and appreciation of Broken Arrow Fire. We have deep admiration for all the first responders, and it's your excellent reputation that makes us want to work together on this wonderful program. We want to thank you for allowing our family to collaborate with your family, with Broken Arrow Fire, on this wonderful community program. So thank you very much.
At this time, I'd like to introduce Roger Green. He is a cardiac survivor from right here in our community, and the goal of PulsePoint is to activate citizens to be responding to other citizens in need. So we hope this spurs a citywide, community-wide conversation about the need to learn CPR and be active in using this app in our community. So I'd like to introduce our cardiac arrest survivor from Broken Arrow Public School System, Roger Green.
Thank you. Well, I'm very happy to be here today, obviously. And the reason why I'm here today is because of the fast action and the training and the professionalism of people standing behind me, as well as some of our coaches and trainers at Broken Arrow Public Schools. And that's what PulsePoint is all about. I was sitting in the press box. I was the announcer for a varsity baseball game, and I had just finished introducing the starting lineups for both teams, ready to play the national anthem. and I passed out. My heart stopped. And I had asked one of the coaches to come and sit in the press box with me. And about 5 years ago, Broken Arrow Public Schools started a CPR training and certification program for our entire coaching staff and all of our trainers. And it has paid tremendous dividends, obviously, because I'm still here because of that. And that's what PulsePoint is all about: quick reaction time, getting people involved as quickly as possible. And within about 20 seconds, this coach that was in the press box with me began CPR and was calling for help. And so they brought in the portable AED that had been provided by the fire department, and then within 4 minutes of receiving the 911 call, the fire department responded. And their professionalism is just unbelievable. And PulsePoint is a huge part of the reason, the quick reaction time, why I'm still here. And I just want to say thank you to Broken Arrow for putting this program together, and thank you to Broken Arrow Public Schools for their emphasis on training the entire coaching staff. So thank you very much.
Well, again, we want to thank everybody for attending today. Thanks for the media for coming out and covering the launch of PulsePoint here in Broken Arrow. That will conclude the press conference. We will all be available for comments or interviews one-on-one if you'd like.